Hello, my name is Ethan Perez, and this is my third narrated presentation. It's going to follow the same format as my other two presentations, and this week is about schizophrenia. So the first thing we're going to talk about is the history, the statistics, and common features you would find in people who have schizophrenia. So the global and U.S. prevalence in America would involve about 24 million people worldwide and 3.2 million people in the U.S. The typical age of onset would include the late teens and early 30s, and earlier onset typically occurs in males rather than females. Some common symptoms you would get when you're starting to obtain schizophrenia would be hallucinations, delusions, disorganized thinking, and negative symptoms are core features of schizophrenia. The impact on daily life would impair your relationships, employment, and quality of life, highlighting the need for support. So here's some history over schizophrenia. And the early definitions of it was initially termed dementia praecox, emphasizing early onset decline. Term schizophrenia, meaning split mind, highlighted fragmented thinking and emotions. Evolving understanding. Schizophrenia is now seen as a spectrum of diverse cognitive and behavioral symptoms. Impact on perception. Historical views influence stigma, underscoring the need for education and advocacy. So here are the diagnostic criteria. The DSM-5 diagnostic criteria for schizophrenia. So the diagnostics requires at least two symptoms, including delusions, hallucinations, or disorganized speech during a 1 month period. The duration of symptoms. So continuous disturbance must last 6 months, like many other disorders, with at least 1 month of active symptoms for diagnosis. The functional impairment. So symptoms must cause significant impairment in work, relationships, or self-care abilities. Clinical importance. DSM-5 guide accurate diagnosis of differentiate schizophrenia and support effective treatment planning. So, for the types of delusions and hallucinations, I was a little confused on what the rubric wanted, so I hope this was close to what you were expecting. So, delusions explained. Delusions are firmly held false beliefs despite evidence, including persecutory, grandiose, and somatic types. Hallucinations overview. So hallucinations are sensory experiences without stimuli affecting auditory, visual, olfactory, gustatory, and tactile senses. Common delusion types. So persecutory, grandiose, referential, aromatic, and somatic delusions are common in schizophrenia. Sensory hallucination types. Auditory hallucinations are most common, with visual and other sensory hallucinations also occurring frequently. Now we're getting to the physiological insights, and right here to the left I have a picture of what I'm going to be talking about in a little bit, and there's a lot of words that are a little bit difficult for me to say, so I'm going to try my best. Brain structural changes. MRI and PET scans reveal reduced gray and white matter in key brain regions linked to schizophrenia symptoms. Neurotransmitter imbalances. Dopamine overactivity causes hallucinations, while glutamine and GABA or GABA imbalances affect cognition and emotion. Implications for treatment. Understanding brain changes inform development or targeted therapies and improves diagnosis of schizophrenia. So here's some genetic and epigenetic factors. The polygenetic factors. Schizophrenia involves many genetic loci, including common, rare, and copy number variants increasing disease risk. Epigenetic modification. Epigenetic changes like DNA methylation affect gene expression without altering DNA sequence, influencing brain function. Molecular and cellular effects. Transcriptomatic and proteomatic studies reveal disrupted protein networks impacting synaptic signaling in mitochondria and immune responses. And immune response. Stem cell disease models. Patient-derived stem cell models replicate schizophrenia phenotypes, supporting genetic and epigenetic contributions. Okay, treatment options. So here are some pharmacological treatments. Go back to that. So types of antipsychotics. First generation antipsychotics block dopamine receptors, which the dopamine overstimulated would give you hallucinations. This reduces hallucinations effectively. And second generation antipsychotics target dopamine and serotonin receptors and have fewer severe side effects. The side effects and compliance. Side effects like weight gain and sedation may reduce adherence. Long-acting injectables help improve compliance and individualized treatment and monitoring. Treatment plans are personalized with regular monitoring to manage side effects and improve outcomes. Psych- Psychosocial and supportive care. Cognitive behavioral therapy. So, CBT helps manage schizophrenia symptoms by challenging disordered thoughts and building coping skills. Family therapy benefits. Family therapy improves communication and reduces relapse by involving relatives in treatment. Community support programs. Programs like ACT provide holistic care, including social skills, training, and housing assistance. Self care and support groups. Self care and support groups enhance well being and reduce feelings of isolation. Um, okay, so here's some lived experiences, patient perspectives, challenges of symptoms. The hallucinations and delusions cause distress and confusion, impacting daily life and responsibilities. The importance of support is empathy from family, friends, and healthcare providers are crucial for patients overcoming stigma. So, reducing stigma through awareness and sharing lived experiences fosters inclusion and reduces isolation of those who are suffering with schizophrenia. Treatment and management. Early diagnosis and consistent treatments help patients manage schizophrenia and improve their quality of life. So, here's some challenges for the caregivers and people who provide support for people they know with schizophrenia. The emotional and logistical challenges. Caregivers face emotional stress, burnout, and social isolation, especially during early diagnosis stages. The need for education and symptom management. Many caregivers lack adequate education about schizophrenia and struggle managing symptoms like aggression. Support system and resources. Peer groups, toolkits, and professional guidance sustain caregivers' well being and improve patient outcomes. Community interventions. Community service help caregivers with housing, healthcare, and crisis navigation for holistic patient care. Conclusion. So I don't have any conclusion. This is just my final slide, and it's a bunch of references I used throughout the presentation. Thank you so much for listening, and I think this is the final one, but I'm not sure. But yeah, thank you.